My name is Dr. Joe Dusseldorp. I'm a specialist plastic surgeon and a member of the Royal Australasian College of Surgeons. And my specialist area of interest is DIEP flap breast reconstruction, which is using the patient's own abdominal tummy tissue to rebuild breasts after mastectomy. And this is for women who are either facing a mastectomy because they have a cancer diagnosis, or they may be having a prophylactic or risk-reducing mastectomy if they have a known gene mutation or a strong family history of breast cancer. And so the DIEP flap operation enables us to use the patient's own tissue rather than an implant to rebuild the breast so that it can be soft and warm and not have the side effects potentially of an implant-based reconstruction. And it's something that is not suitable for everyone, but certainly women should know they have the opportunity to have this operation either in the public or the private system in Australia. And that's something that it's my goal for all women to know about this operation and to at least know they have the option, even if they choose at the end of the day not to have any reconstruction at all, which is a perfectly valid choice. The DIEP flap operation involves a complex procedure where we take the blood vessels and the tissue from the abdominal wall, usually that lower part of the abdomen that most of us have, myself included, and we use that tissue then to rebuild what's missing when a mastectomy is taken away. So we're using it to replace the breast tissue, really the glandular elements. And in many cases, we don't need to remove the skin or the nipple from the breast. We can just replace what's missing inside, leaving the breast looking and feeling whole. There are some risks, as with all surgeries, that women need to be aware of before undergoing the DIEP flap operation. Specifically, that the tissue that's transferred from the tummy area may not survive. There can be complications and so on. However, the complication rates are very low, less than about 1% for major complications and around 10% for minor complications, and something which a well-informed patient should feel confident to go forward with this operation, which is performed routinely now and is considered our gold standard of care for breast reconstruction. The recovery process after DIEP flap is of concern for a lot of women, particularly young mothers and people who have professional jobs. However, I would reassure patients that it is around 6 weeks of full-time recovery and then about another 6 weeks of what I would say people are able to get back to their daily lives, but still feeling some after effects of the procedure. The majority of the recovery actually is in the tummy area, where we do perform what's akin to an abdominoplasty or a tummy tuck procedure, but the breasts generally recover quite quickly. And something which the recovery process is important to take into account for women, because they may be juggling lots of other things in their professional and family lives, and something to be understood that implants are an option that have a slightly different recovery profile, and understand that also flap closure itself has a different recovery profile as well. A recent innovation we've been aiming to try to research is sensation reconstruction after mastectomy. And it's something that when we're doing the DIEP flap surgery, not only are we rejoining blood vessels, but we can actually also rejoin nerves to try to bring back sensation to that part of the breast which has lost sensation at the time of the mastectomy. And we'll be presenting at the PSC conference this week our results, but it is a growing space, and a space where I think there's hope that we can do better in the future. My practice is based at the Chris O'Brien Lifehouse in Sydney, and we see patients from regional areas as well as from Sydney, and actually some patients from interstate as well. And I think Australian women should know that they do have the opportunity to seek care from specialist centres outside of their local area. And if they would like to do that, we also can help them with telehealth consultations, even just for getting a second opinion or perhaps understanding their options a little bit more. So they can reach out to us through the Chris O'Brien Lifehouse or through my personal website.